Good day everyone, I am Claudet Pornuevo and I'm going to perform LEOPOLD'S maneuver return demonstration. LEOPOLD'S maneuver is an easy to perform non-invasive method to determine the position and the presentation of the fetus in the uterus. So LEOPOLD'S maneuver is used along with an assessment of the shape of mother's pelvis. This process is done after 36 weeks gestation to help the expectant mother and the healthcare provider to predict whether complications will occur during delivery and whether the patient will require a cesarean section. Prior to the conduct of the procedure, I have to prepare the necessary equipment needed, which includes a stethoscope, towel, and a pillow. Before doing this procedure, I have performed hand hygiene to protect my patient and myself from any infection and cross-contamination. Good morning, Ma'am Hilton. My name is Claudet Pornuevo and I will be your student nurse for today. May I know your full name? And your birthday, please? Okay, great. So how would you like me to call you today, ma'am? Okay, Mrs. Hilton. So allow me to close the door and curtains to give you comfortable feelings and to respect your privacy. Now, Mrs. Hilton, I'm going to perform LEOPOLD'S maneuver to you. So first, let me discuss what is LEOPOLD'S maneuver. LEOPOLD'S maneuver is an easy process to determine the position, presentation, and engagement of your baby inside your uterus. So what I'm going to do is feel your abdomen and add a little pressure to feel and determine the position and presentation of your baby. Will that be okay with you? Okay, great. So there are 4 steps on how to do the LEOPOLD'S maneuver. The first step is the fundal grip. It is also called the maneuver 1. This method will help us to determine if your baby is in breech or encephalic presentation, meaning it's either the head that is on the top and the buttocks is at the bottom, or the head is at the bottom and the buttocks is on top. And the second maneuver is the umbilical grip. It is also called the maneuver 2. So this method will help us identify the direction that the fetal back is facing, and it will also help us to determine the small parts of the arms and legs. So the pollex grips or the pollex grip is the third maneuver. This maneuver will help us confirm the maneuver 1. So meaning, if we found that the head is at the fundus, then we know that presenting part must be the buttocks. Or if we found that the head is at the bottom, then we can conclude that the buttocks is on the fundus. So once we find the baby's back, we can now identify the baby's heart tone. And lastly, the 4th maneuver is the pelvic grip. So this maneuver is only done if the fetus is in cephalic presentation. It will help us identify the fetal attitude and the degree of fetal extension into the pelvis. Okay, now Mrs. Hilton, before we proceed to the procedure, I encourage you to void first so that later you will not feel uncomfortable. So while the patient is in the comfort room, do hand hygiene again to completely sanitize. Okay, now ma'am, what I need you to do is to lay down and flex your knee slightly. Also, I need you to turn your side a little bit so that I can place the towel under your hip. Okay, Mrs. Hilton, are you ready to start the procedure? Okay, let's begin. Take note, when doing the first, second, and third maneuver, always stand beside the client facing her head. Okay, let me expose only the area that we're going to check, okay? Okay. Now I'm gonna do the first maneuver using both of my hands and place it in the fundus, like in diamond or triangle shape. I am now palpating the part that is in the fundus. If it is firm, round, and hard, then it's the baby's head. But if it's soft, then it's the baby's buttocks. So for the second maneuver, I'm going to palpate for the baby's back. We can also search for the arms and the legs of the baby. So now for the third maneuver, I'm going to place my hand in the lower portion of your abdomen above your symphysis pubis. Is that okay with you? Okay, so we're going to check if the baby's head is engaged or not. So the baby's head is still able to move and can push upward as I place my fingers in here. Therefore, the baby's head is not yet engaged. So now for the last maneuver, take note to stand beside the head of the client. Okay, so for the fourth maneuver, I will place both of my hands in the uterus area. Is that okay? Okay. So I will now feel for the cephalic prominent for the if the baby is flexed or extended. We're now done performing the procedure, Mrs. Hilton. Please allow me to put back your shirt and cover up you again so you don't feel cold. Thank you, Mrs. Hilton. After doing the procedure or the LEOPOLD'S maneuver method, make sure to cover up the patient for comfortability ensurement. So after doing the procedure, we're going to validate the data that we've gathered. So okay, Mrs. Hilton, your baby is at 37 weeks age of this gestation. However, as I palpated the baby's head in the uterus area, I found out that the head is not yet engaged and it is still floating as it's still movable. So now that we've done doing the LEOPOLD'S maneuver procedure, I am now going to do hand hygiene or to wash my hands again to make sure that I am protected from any infections or cross-contamination. So now we're doing the documenting of the findings. So as what I've said earlier, the baby is in the 37 weeks age of gestation and it is not yet engaged. The head is not yet engaged and it is still floating as it's still movable. And I therefore conclude that the mother can have a normal deliberation. Thank you.